Excellent. Thank you so much, Sister Ann. To move right along, we're going to have Adán Merecias. Would you like to? You could either sit at the here or you could go up to the podium, whichever works best for you. Sounds great.
So this is. Oh, okay. Two backs. Oh, okay. Buenos días. My name is Adán Merecias. I work as a community health worker. Sorry, I was standing on the other side. And I work for an agency called Familias and Acción, which is out in Portland, Oregon. And my work is that of a community health worker. I know there were talks this morning about community health workers, community-based agencies, and the work that we do. So I'll be speaking on that, and also on our agency. The picture that you see there are our clients. All of them are from our support group. So we have a Latino support group for somebody that has a chronic disease and their families. So this is a trip that we took to a garden, and the client that you see standing on the front of the picture, kneeling with his hat, is Mr. Eliseo, and that is his community garden. He started that after taking one of our classes. And basically, all he does with anything that he is able to grow is he shares it with his support group members. So there you see a lot of things there that are from Mexico, like corn. There's squash. There's green beans, cilantro, and a few other things that he's able to grow. On a couple years a month, and basically. What we do a lot of times is we try to engage our community as much as possible and bring all that knowledge that they already have and bring it out so they can share with other members of our community. And our agency was started back in 1998. Primarily, we started providing services to Latina women dealing with domestic violence, but over the years we have grown and we have expanded in our programs. And one of our biggest programs is the community health workers programs, which we serve families that are dealing with a chronic disease or cancer. And we have a number of health education classes that we provide as well, and the support group that I just mentioned. So as community health workers, I believe that many of you have heard the term throughout this morning, but I just want to mention what it is to me. In the communities in Mexico, it's very common to have community health workers. We call them in Spanish promotores or promotoras. And basically, you're a member of that community that's been trained in providing health education services to the community and also in engaging the community a little bit more in, to have better health outcomes. And so that's a lot of what my community is about. And I guess I've been a community health worker for a little while. I guess it started back when I was in college. I started volunteering with the free clinic out in a city called Hillsborough. It was the Essential Health Clinic. Back at that time, we didn't have the Affordable Care Act, so a lot of our families did not have access to health insurance. Sometimes the only option they had was that free health clinic. So I started there as an interpreter, and I was helping Latino patients, go and meet with their providers and make sure they would understand the information that they were being provided as well. And I started getting more involved with other agencies, learning about other programs, and that's how I ended up becoming a community health worker. And that's a lot of my work that I do at the moment. But within that role of a community health worker, I also started developing our community health education programs, which is very essential because if you want to talk about, preventing diseases, then you have to start before our clients even get there or our community even gets there. So we do a number of classes that have to do with diabetes, that have to do with gardening, that have to do with walking, that have to do with, being able to be prepared when you go to appointments and you have all those questions ready for your providers. So that's a lot of what we do. We empower our community. We have a specific program that I want to talk about, and it's called Empoderate, or empowerment, as it would be the translation into English. And Empoderate is basically an introduction into palliative care. And the importance of this specific program, this specific class, I'm sorry, is that it tells our clients that, why you need to be prepared to, before you even end up having that discussion with your provider of, you have a couple weeks, a couple months left. It's important for you to know what questions to ask. It's important for you to have somebody else that can guide you through the process, because it can be very challenging. And so this specific class kind of tells our clients, these are the questions that you should be asking. These are the things you should be looking for. You need to have support from somebody. What are the resources in the community that you can get? And if you don't have all of those things, what's around there that you can be able to, access, and you can be able to use those services so you can have, a better health. And basically, throughout my work, I see a lot of clients that are dealing with cancer, with diabetes. And we did a project with Kaiser Permanente, and this was specifically in embedding a community health worker into a health system. And my role primarily was serving Latinos who have a chronic disease. And I was working with, providers, and also navigators within that specific health system. And throughout that work, I focused primarily on, being able to have our clients be able to access the services a little bit easier, being able to show them what other options were available through that same system that they were not accessing in the past. So some of those things were like accessing the health coaches, the classes that were available, or the pharmacies that they could receive their medications through the mail. But at the same time, we talked a lot about the advanced care planning. Kaiser calls it, they have a specific training that they send me through, and this was specifically on advanced care planning, and it was, I don't remember the name off the top of my head, but basically I had to do a discussion with my clients whenever I went and did home visits. So this was not just for somebody that was dealing with cancer, or somebody that was dealing just with a terminal illness, basically. It was anybody that wanted to have this discussion. And we ended up, having multiple discussions with multiple clients about this. And it all came to the point where, we would talk about what are you doing right now in case something was to happen? Because we know that, it's not always just about having a condition. I could be driving my car and, something could happen to me. It could be, doing an activity and an accident could happen. And that's how we would start the conversation. And, in our community, it's very common to talk about things that are unrelated to death. But at the same time, we know that death is something that we also, talk about in our community, because we do celebrations the Day of the Dead. It's something that, is very common in the Latino community. So that is already happening. And we have to, have that discussion and have that talk, because we know that it's inevitable. It's going to happen. And we have to make sure that our clients have that information, that they have that resource, and they have that form that they can complete, and they can assign a specific member of their family or a specific member of their community that can speak on their behalf. And a lot of times it was, talking to them and then giving them a couple of weeks so they could look over the form and talk to their family members. A lot of times maybe they weren't ready to have the discussion with me just yet. But the reason why they decided to bring me and kind of get me started in that specific discussion, that it's called life care planning, and basically is because I was going into the homes with a lot of my clients. So I was going into the homes, I was learning, about their families. I was learning about the environment. I was learning about, different things that providers were not seeing, that, navigators were not seeing. So I was able to get a better sense as to what was happening at the home. And that, can build that trust. And the trust that I was able to develop with a lot of these clients made it easier for me to be able to have those discussions and to have those talks. But at the same time, we were able to figure out the things that were going on in their home. Maybe it was issues with food insecurity. Maybe it was issues with transportation. Maybe there were other things going on at the home that were not being addressed. Maybe issues with mental health or emotional health that were not being addressed. So it was building the trust, building that connection, and that relationship that made it easier for them to be able to engage with me and be able to disclose certain things that they would not tell their providers. And I just want to share some stories, I guess, on my work. One client that I got referred a couple years back, he was diagnosed with cancer, and before I even got into connecting with him, he was, going to multiple appointments. He was continuing with this treatment, and I ended up, going to the clinic visits with him and going and doing home visits. So I ended up learning a lot about him, and there were a lot of things that were happening throughout the months that I was learning from him. And one of those things is that he didn't have a clear understanding about his diagnosis, and he wasn't aware that he had a couple months to live, and he asked me this question, and I had to refer him back to his provider. He asked me, Adam, I've been going to appointments, and I've been going to the doctor for so many months. So when is is this treatment gonna help me get better? Is this treatment gonna take care of the cancer? Because it seems like it's going nowhere. So I told him, it's a question that you should ask your provider. I'm willing to go with you and be there, and we have to make sure that you get that question answered, because that is a good question. So we ended up going to his doctor, and he asked that question, and his doctor, had to find a way to explain to him that the treatment that he was getting was not necessarily to treat the cancer, but it's basically just to prolong his life. And my client ended up making the decision that maybe the treatment that they're giving me right now, if it's only for that, then I have to make a choice. And that choice is talking to my family, talking to the family that I haven't seen in Mexico. So his decision was in ensuring that everything here in the U.S. was left okay. He was making sure that his electricity bill was being paid, that his rent was being paid, that he had all those things closed before he ended up deciding to leave. But at the same time, he ended up talking to his family, because even his family was not very aware of his condition. I mean, they knew he was going to appointments, they knew he was going and getting this service, but they were not aware of how complicated it was, and the treatment was only prolonging his life, but it's something that he didn't want at that point. He hadn't seen his daughter for so many years, and his choice was not to stay here in the U.S. His choice was to spend it with his family. And I think it was a good thing that that question came up, because it was important for him to be able to make the decision on time. I think a lot of times our families, don't have a clear understanding of what's happening, and that's why a lot of times community health workers are somewhat involved, and we're that bridge between the cultural piece that we're able to address in the clinics that provide the service. So a lot of times it's making sure that our clients get that information, that we have to be there as advocates, and sometimes we have to be there, I guess, in a way, making sure that they understand our role, because the community health worker can be somewhat new to some of the providers as well. So there's many times where I have to tell them that I'm not there to interpret for the patient, because it's a lot easier for them to just pull me and be like, oh, you speak the language, maybe you can interpret, and I have to say, no, I'm here with the patient. I mean, I can do the basic things, but when it comes to certain discussions, when you're talking about cancer, when you're talking about treatment, those are things that somebody that's more well-informed, more well-trained on it, that they can do a better job. And primarily, I'm not there to interpret. I'm there to make sure that my client understands what's going on and what's happening. I'm there to make sure that they understand the diagnosis, and that they understand that they have questions that they need to ask, and they, all those things need to be addressed, so they can have a better health outcome. And this is not just specific to the Latino community. This happens in other communities as well. And besides the community health worker role, I've mentioned that we do other things. We do the health education classes. We do culture-specific training for health professionals. And I just want to mention briefly, because I know my time is running out, but the person that you see there is Maria. She's a longtime volunteer with our agency. She started initially with the chronic disease self-management class, and throughout the years, she's been learning other programs. So she worked with the Oregon Food Bank in changing they have a gardening class that they teach. So she ended up modifying that and making it better for our community. I think there were talks this morning about, how certain communities might be from the same ethnicity, but that doesn't necessarily have the same, journey or the same story. So Maria lives where a lot of our clients live, and I also get to, be part of my community as well on a daily basis. I live in a city, I would say 26, 27 miles away from Portland. It's called Cornelius, which is 54% Latinos. And it's very interesting because I can walk, on my community and get to speak the language, but at the same time, I get to learn from my community. And I have a little girl that's growing up at this point, and she's, getting to know her community, engaging a little bit more. But Maria is a prime example of what happens when, you bring somebody into an agency who is willing to learn, who has a lot of those skills, or who might be willing to develop additional skills. And she was able to, not only be trained to give specific classes, but she was also trained in other classes that she was able to modify and change so they would have a better fit for our specific community. And I guess the next thing that I want to mention is that we have a conference going on in June, and basically the reason why we're talking about food in our conference is, food is a big component in our community. Whenever we gather over food, and we have to talk about that because the choices that we make are not always the best choices, but we have to think back as to how we ended up at that point. A lot of us move into a new country. A lot of us, try to access what's available. So we have to talk about what resources are available for food, what's being addressed, what's not being addressed. But at the same time, how our diet has changed over the years. Somebody mentioned this morning about colonialism, how that has affected our community. And that's what we're going to speak about a little bit more. We have a specific program that we developed recently. It's called Abuela, Mama y Yo, and it talks about epigenetics and, the effects it can have on future generations. So we're talking about, the granddaughter, the mother, and the grandmother, basically, the journey of them, being able to change a lot of those things to make those choices that are better for their families so they can have better outcomes, because we know that a lot of times what's available is not the best in our community, but we know we can change it. So we know we can create community gardens. We know we can create spaces, and we have to start somewhere. Thank you.